Good evening, folks. Thanks, everyone, for joining us today's virtual public meeting on Forging Ahead. First, the MBTA team has a presentation, and we ask that you please hold all comments until the end of that presentation. Second, we'd like to remind everyone this meeting is being audio and visually recorded and will be made publicly available. Third, we have planned the meeting to go until 8 p.m. today with a hard stop at 8:30 due to our interpreters. Before we get started, I'd like to go over a few meeting controls for folks who are not familiar with Zoom. Next slide, please. You will have live language interpretation at today's meeting. I will explain how to select your preferred language now in English. Written instructions are provided on your screen now in Spanish and Chinese. In your meeting webinar controls at the bottom of your screen, please click Interpretation. Then click the language you would like to hear. Even participants listening in English should select English so that they can hear any comments being spoken in other languages. Next slide, please. This meeting will also include ASL interpreters. The meeting host will spotlight the interpreters to ensure that they can be seen at all times. The ASL interpreters expect to switch approximately every 20 minutes. If at any point you cannot see the interpreter, please let the tech support know using the chat. Next slide, please. We also have closed captions for this meeting. If you do not see the captions, please press the closed caption button at the bottom of your screen to get them started. Next slide, please. If at any point during the meeting you have any technical questions about Zoom or the accessibility features of today's meeting, please chat tech support. Next slide, please. Following the presentation, we will answer clarifying questions from the Q&A feature and then open the floor for comments and testimonials. If you have a clarifying question, please type it into the Q&A pod during or following the presentation. Due to time constraints, we may not be able to get to answer all clarifying questions. All questions will be included during the meeting record. If you have any questions on using the Zoom platform, you may use the chat to MBTA tech support to help resolve any issues. On today's call, we are joined by MBTA General Manager, Mr. Steve Poftak, and FMCB Director, Mr. Brian Lang. We would like to acknowledge those elected officials who have joined us here today and their staff. Now I'd like to turn it over to General Manager Poftak to get us started. Mr. General Manager.
Thank you, Angel, and thanks to everyone, particularly the MBTA staff, providing the support and the folks doing the translation. Most of all, thank you to the general public, our riders, our stakeholders who've taken time out of their schedule to join us not only at this meeting, but also in the meetings that preceded this. This is a very important part of the process. We genuinely want to hear your feedback. We've already gotten thousands of comments that the staff is busy analyzing and also thinking about any revisions we might potentially make to the proposal that we will bring to the FMCB on the 7th. I just want to make a few general remarks. I think the first thing I want to make clear is we do not want to be in this position. We do not want to be in the position of reducing service. We have worked collectively over the past several years to make the MBTA serve its riders better. We have risen the level of capital investment in this authority up to almost $1.7 billion this year, and we will continue to keep that momentum in the investment. We do intend to continue to improve this agency. However, we are in a situation where we are facing a budget gap in FY22 that we will go into the presentation that we currently estimate to be somewhere in the order of $575 to $600 million. We faced budgeted challenges this fiscal year and in the previous fiscal year as well because of declining ridership. And we were able to plug that gap with $827 million in stimulus funding and CARES Act funding from the federal government. We do not have CARES Act funding available to FY22. And we're in a situation where we have seen a significant drop in ridership and a significant drop in fare revenue. A year ago, pre-COVID, we were running almost 1.3 million trips per day on the MBTA. Today, that number is closer to 330. I'll save you the trouble of doing the math, 330,000, pardon me. I will save you the trouble of doing the math. That's approximately 25 to 26% of our pre-COVID ridership. Yet we are running almost the same service. I would note that ridership did not decline in equivalent amounts across all modes on the system. Most of our commuter rail trains are running at approximately anywhere between 10 and 15%. Our buses overall are running a little over 40% ridership. However, that masks a great deal of disparity. We have certain bus routes that are closer to 60%, and we have other bus routes that are significantly lower than that. We are now going through a process, which we will detail in this presentation, to protect the essential services and protect the riders that depend on them. We view it as an important part of our mission to identify what are the essential services, what are because they serve transit critical populations, and they either have a significant amount of ridership or are likely to have a significant amount of ridership in the next year. We really have no choice but to make some very difficult decisions, and we value your input in terms of evaluating our proposal and letting us know where you think we've made mistakes. I do want to make it clear that we are not proposing any fare increases at this time, and that is not part of this process. I also want to make it clear that these proposed service changes would not take effect immediately. They would be phased in because of some of our operational issues, but also because we want to be sure that we communicate it to our customers. And they would be phased in some as early as January, certain changes on the commuter rail, and then phased in over the spring and early summer. Right now, we plan to present a package of changes to the FMCB on December 7th, with the expectation that there will be a vote on December 14th. I do want to make it clear that this is a reaction to a significant drop in ridership and a significant drop in revenue that has caused this significant shortfall in FY22. This is not a long-term strategy to make the T smaller. And one of the things we'll be seeking guidance on and valuing your feedback on is when we have additional resources, what are the things that we should prioritize? We do plan to have a robust process where we analyze places where ridership is growing or the potential need for service is expanding, and we will evaluate what changes we may need to make in service as we go. But we do want to think about what are the things we'd like to add back. We do, obviously, there are ideas out there in the public domain about, for instance, there could be another federal stimulus bill, there could be other revenue coming to the T. We will obviously attempt to use that revenue judiciously and add back service where appropriate, where there is demand, where there is ridership. For the current period of time where we have very low ridership on some aspects of the system, we think the correct thing to do is marshal our resources so we can be best positioned to add service back when ridership returns. So again, I thank you for participating, and I look forward to hearing your comments tonight.
Thank you, General Manager. And so, General Manager, you're doing the presentation tonight, so I turn it over to you one more time.
Great. So let's get right to it. Obviously, there's a lot of information here. I'll attempt to go through it as quickly as I can because we do want to leave as much time as possible for comments. Just to frame this up for you, the Forging Ahead process is how we are thinking about how do we preserve this essential core of services that are serving transit critical populations in places where there is ridership or expected ridership. And I do want to make it clear, and I'll talk in more detail on a slide to follow. I do want to make it clear that this is the last pocket we want to look at, is service reductions. We have looked at reducing internal spending that wouldn't have a customer-facing impact. We've taken a look at our capital program and reallocated a specific area of our capital income to support the operating budget. And we are planning, through this process, we seek to preserve an essential set of services that will then allow the MBTA to build back once we have additional ridership and once we have additional resources. One thing I want to make clear is the MBTA is not alone in this. This is not an MBTA problem. This is a transit problem. We've seen massive losses in ridership in systems across the country. You can see the MTA is predicting a budget loss of $12.4 billion. That's the gap they're trying to solve for over the next 3 years. WMATA just this week put out a proposal. Their deficit is something on the order of the deficit we're facing. They put out a proposal to eliminate all weekend subway service, end subway service at 9 p.m. on weekdays, close 19 stations, and suspend a significant number of bus routes. I won't read the whole slide to you, but I think it's worth understanding that many other properties across the country are facing similar challenges. I also, just to give you a base to think about, our budget is $2.3 billion. And the deficit we're talking about is somewhere in the order of $575 million to $600 million. So it is a significant portion of our budget. One of the things that I talked about earlier was how do we resolve the budget gap, and that we wanted to talk about reductions in service as a last resort. So just to give you a sense of what we've done, we are now taking steps to save money in FY21 so that we can apply them to next year and mitigate some of these issues. As I said, we have reallocated. We have a certain pot of money in our capital budget that's flexible, that can be used for capital. But it can also be used for certain operating expenses, and we are using that money. That's the blue part of the pie chart you see on the screen in front of you. We think that this is appropriate to do in the short term to deal with what is an unprecedented crisis. In the long term, we don't think this is a long-term strategy. We don't want to get into the practice of taking capital money away from the T to fund the operating budget. We don't think that is a good long-term strategy for the T. As I said, we are looking at internal savings. That's the green slice of the pie. It's marked department programmatic here. The board set a goal of finding $90 to $140 million in savings. We expect to hit that goal of the high end of that goal, $140 million. That, by hitting the high end of the goal, that means we have to reduce service less. And then we come to service level planning, where we are currently looking at approximately $128 million or more in potential cuts. I talked about the drop in ridership, and this chart shows you ridership basically from March 1st on. It's benchmarked against the last week of February, kind of the pre-COVID, what did ridership look like? What you can see here is that ridership dropped precipitously in March as things closed, and then it began to rebound, but rebound slowly. I would note and draw your attention to the fact that bus, which is the yellow line, the ride, which is the black dotted line, and the blue line, which is the blue line, those three services dropped the least. And they're the ones that have come back the most, rising to a level a little bit above 40% for a good chunk of the fall. Red, orange, and green line have stayed at about 25%, and you can see that commuter rail and ferry have significantly lower ridership, somewhere between either the high single digits or the low teens. I think it's also two things I would draw your attention to. If you look closely to the right-hand part of this slide, you can see that the incremental increase in ridership levels off in September, begins to fall slightly in October, and it's not on this chart, but November continues that slight drop. So we have seen ridership begin to decline again. The other thing I would draw your attention to as you run your eye across the width of this chart, the ride in particular has some bumpiness, and those are because of extraneous events. What you don't see here are any major inflection points. As the governor announced the various phases and steps of reopening, you don't see any major increases in ridership. And I think that's an important thing to note. I know that there's, I think, a very optimistic public discussion about vaccines. I think the reality of the vaccines is that they're going to be distributed and phased in over a long period of time. I don't think it is not a binary event. You're not going to see sort of one blip on the chart where ridership goes up by a tremendous amount. And I think this previous experience is instructive of that. The MBTA is planning a variety of scenarios and modeling them to build into our budget projections. What I'm showing you here are a sort of a variety of the three scenarios. I would note that several of the scenarios anticipated vaccine distribution roughly consistent with what has been publicly, which I guess has been publicly suggested as what will be the likely path. What you see here is that ridership doesn't get to 100% even when we're into the middle of calendar 22, even on bus, which has been our most durable source of ridership. We will continue to use these scenarios to help inform our revenue planning, but I think I just want to give folks a sense that we have built a solid base of data here, data that is behaving consistent, or at least some of the scenarios consistent with the events we're seeing publicly. I also want to add that Forging Ahead is intended to be an iterative process. We have put forward a proposal which we are now seeking feedback on. We will look to the board for their guidance and insight on to what is the final package. These service changes will go into effect over a period of time, and we will continue to revisit service levels and demand over time to determine when is it appropriate for us to add service back. So I want to return to this discussion of essential services. What we've done is built a framework across two dimensions. One is transit criticality. We've defined transit criticality as a basket of populations that includes low-income riders, people of color, and areas with significant concentrations of people with disabilities. And then we've also looked across the dimension of ridership, modes and routes that are seeing high ridership now or have a significant propensity to add ridership in the next year. And what you come up with when you analyze our service within this framework is the essential service lands in that upper left-hand box. So you see basically the entire subway system. The green line is limited to the trunk, the Mattapan line, a number of bus routes, and the Fairmont commuter rail line. And then the other boxes have different characteristics, but they don't serve both a transit critical population and a high ridership population. Just to give you a sense of how implementation will work, we proposed this on November 9th. We have gone through a public engagement process and really done our best in a limited period of time to hear from as many voices as we can, and I'll talk about that in some detail later. We are hopeful to have a contingent vote on service changes on December 14th. Then the implementation will begin. As I said, implementation, some limited pieces of commuter rail, if approved, may be implemented in January, and then it will stretch over the spring and early summer. We do have a process currently where we review service on a regular basis and adapt our schedules. We are currently trying to think and be thoughtful about how do we adjust to changes in demand more rapidly? And that is something we're thinking about in order to be prepared if there are significant changes in demand. Okay, let me get to the actual proposed service changes now. I just want to pause for a moment and define my terms. We talked about how we determined essential service across the dimensions of transit criticality and ridership. That's the essential service. What we are presenting here is base service, which includes the essential services plus a reduced level of non-essential services in certain places. So that's what we'll be looking at. We do expect with the base service proposal that in many places it will look very similar to what we currently provide or provided pre-COVID. We do believe, because of lower ridership, that these reductions in service will not significantly increase crowding above the thresholds that we have put in place. We will continue to monitor this and where feasible, redeploy resources. It's also important to note that all of the essential services that we are proposing in this will be run at or above the service delivery policy, which is the policy that the board approved that sets benchmarks for the minimum level of service. I do want to emphasize that most service is preserved under this proposal. You can see the map here that shows you in blue where we are going to continue to provide service above the baseline frequency standards. And then you can see, and those would be the standards set out in the service delivery policy. You can see where we would continue to provide service, but it would be below that standard. And then places where we are proposing to eliminate service. I think it's important to note that we will continue this proposal continues to provide 85% of weekly service hours on bus, 70% on rapid transit, and 65% on commuter rail. The major exception, obviously, is ferry, where our proposal will be to suspend ferry service. And even with the reductions in service, 78.5% of households in the MBTA service area will continue to have access to the MBTA within a half mile. That is a reduction of 3.5%. So onto the actual cuts. What you see here on the chart on the right is a comparison of what our commuter rail service looks like now in terms of ridership. And that's what you see in the solid line and what it looked like pre-COVID, where you see two very distinct and pronounced peaks in the morning and in the evening. Obviously, ridership is significantly reduced. Also, the difference between the peak and the off-peak is significantly reduced. What we are proposing is to stop all service after 9 p.m. on commuter rail. Currently, we will start a train up until midnight and then conclude service whenever it concludes. We're proposing to stop all weekend service on commuter rail. The one exception would be the Fairmont line, which would have bus service on the weekends. We are proposing to decrease weekday peak service and sub-midday service. I do want to be clear, that is a reduction. Last fall, we ran 505 trains per day. Under this proposal, we would still be running 430 trains a day. So you would still have options in the peak, inbound and outbound, and we would be running trains on all lines. We are proposing to close 6 stops where we have low ridership and there's available alternatives. And although we haven't put together the finalized schedule, do anticipate, because we have some variability between lines, the lines where we're seeing higher ridership, we would attempt to provide them with a higher level of service. Under this proposal, we would continue to run 65% of pre-COVID service hours. So that includes the elimination of weekend service. If you look at just weekday service, we would be retaining 85% of weekday service. These are the potential station closures. So it's 6 station closures across a variety of lines. They had low ridership pre-COVID, they have low ridership now, and they have available alternatives in many cases, but in many cases with parking that is available. I can't say whether or not the parking is available on Pride's Crossing, Silver Hill, and Hastings, because those are not our parking lots, so we don't have an idea. And excuse me, the same for Cedar Park, because we don't run those parking lots, so we don't have an idea of utilization. Next, let's talk about bus. Bus has been our most durable service, and I think you see it here. The contrast between the dotted line and the solid line is less pronounced than with commuter rail. You see that off-peak and peak ridership, particularly in the midday, there's not a great difference between the two. I would note that this is an aggregate. This aggregates a lot of information, and as I said previously, we have some routes like the 111 that are operating at much higher ridership levels. One of the things we've been able to do, because we have reallocated some resources from route to route, for the routes where we are seeing high levels of ridership, like the 111, we've actually been able to allocate additional service. So we are providing more service than we did now. We're providing more service now than we did pre-COVID. The proposal we are changing is to stop all bus service after midnight. However, we will continue to start service at the same time. We propose to reduce frequency on essential routes by 5%, and this is an average. On routes where we see significant demand, we would seek to keep service level, so therefore other routes would see a slightly larger reduction. We're proposing to reduce frequency on non-essential routes by 20%. Again, that's on average. We would reallocate on the basis of demand. We're also proposing to consolidate 14 routes, shorten 5 routes, and eliminate 25 routes. Of the 25 that are eliminated, 7 are within a quarter mile of either a bus or rapid transit alternative. 12 of those routes, if you think of the box setup with transit criticality and ridership, 12 routes serve areas that are non-transit critical and have low ridership. And then 6 routes serve areas with a lot of transit critical ridership, but transit critical riders, pardon me, but have very low ridership, and in most cases have alternatives. We are proposing to eliminate the suburban subsidy program, which provides partial funding for service. I would note that the suburban subsidy is a bit of a misnomer. It does serve 4 suburban communities, Bedford, Beverly, Burlington, and Lexington, as well as the Boston neighborhood of Mission Hill. One of the changes, I think it's important to note that this would cause, this change as proposed would cause a change in the ride. If we change the fixed route, that changes the area where we are required to offer ride coverage. We are not proposing to change the ride coverage area. However, places where they are no longer within a specific proximity to the fixed route service would now change from the standard copay to the premium copay. So there would be an additional cost in certain areas where the fixed bus service is being eliminated. The other change would be there would be a change in the hours of operation of the ride to match either the bus, rapid transit, or commuter rail system. It would be consistent with that. We would also lengthen the scheduling window from 30 to 40 minutes on the ride. Again, just to give you a sense of impact, of looking at our pre-COVID ride, only 1.1% of trips would be affected by this, where folks would shift from ADA to premium. These are the essential bus routes, again, that all would run at or above baseline standards. Here are the bus routes, and I'll pause for a moment just to let folks take this in. These are the bus routes where there will be major structural changes or elimination. As I said, a number are consolidated, a number will be shortened and restructured, and then a number will be eliminated, and we put them into these 3 buckets. There's either a nearby alternative, it's serving a transit critical population, but it has very low ridership, or it is not serving a transit critical population, and additionally it has low ridership as well. Actually, I think I covered this in the previous slide. There will be a change in the ADA premium service area. The change will include an additional, the premium copay for folks who are no longer close to a fixed route because of the elimination of a bus route, and also that the ADA premium service times will adhere to the fixed route times and the increased scheduling window. Next, we turn to rapid transit. As you can see, we have some variety here in terms of how ridership has been sustained across the different modes. The blue line on a percentage basis, not on an absolute basis, but on a percentage basis, has retained the most riders. The green line has retained the least. Orange and red are in between. One of the things I would draw your attention to is, particularly on the blue line, the high level of ridership very early in the morning. And I think it's also interesting to note how the peak has shifted backwards on the blue line in the morning as well. We think this is reflective of folks with job schedules outside of kind of the 9 to 5 window, particularly those in healthcare and service jobs who are using the system. We're proposing here to stop all service after midnight, so that's a change from 1 a.m. We are not proposing to change when service opens. As I noted, on the blue line in particular, you've got a lot of ridership early in the morning. We want to be able to serve that ridership. We are proposing to reduce frequency by 20%. I think it's important to talk through what that feels like for a customer. Right now, the MBTA aspires to run during the peak on the red line headways. That's the distance. That's the time between trains. Headways of about 4.5 minutes. A reduction in frequency by 20% means the T would end up running headways closer to 5.5%. Excuse me, 5.5 minutes. So it is a change, and it is it would be a 20% change, but in terms of the impact on the customer, obviously it's a longer wait time, but the impact I think comes across somewhat differently than when you just read 20%. The other piece I want to mention is stopping E-line service at Brigham Circle. We are proposing to stop at Brigham Circle and then have our customers take the Route 39 for the remainder of the journey. We would also keep a close eye and add service on the 39 to avoid crowding. The changes on ferry would be, we are proposing to suspend ferry altogether. So this would be an elimination of both the Charlestown ferry, where the 93 bus is an alternative, as well as on the Hingham and Hull ferries, we would put forward the Greenbush line as an alternative. One of the things that I talked about is we do want to think about, and we would appreciate feedback on what we should prioritize as we build back. If there are additional sources of funds, trying to understand, obviously the places where we get demand will be one of our guides, but it would be helpful for us to hear from the public about what are the things we should be building back. This is sort of the framework within which we have thought about what are some of the areas where we could potentially build back if there was ridership and there was revenue. I do want to say for the record, the A's and the letters and the numbers are simply there to denote them. This is not any type of ranking that we have. It's simply an identifier. So if folks want to give us feedback on that, we would greatly appreciate it. I do want to just do a recap on how our public engagement process is going to work. We appreciate obviously any feedback you have on the framework we put together in terms of essential services. What are the things we should be prioritizing as we think about adding back? What are the changes that are impacting you? What are the things that we've missed? And what are the ways you would like to see us adapt this package? So with that, I will close the formal presentation. I'm happy to walk through this, or I don't want to take too much of Angel's work here either.
Thank you, General Manager. Clarifying questions can be submitted via the Q&A pod. While we may not get to all questions or all the comments, all the comments and questions are part of the official meeting record and will be shared with our MBTA leadership. Next slide. To make a comment, you must virtually raise your hand. To do this on the computer, press Alt-Y or click the raise hand button at the bottom center of your screen. On a mobile device, simply tap the raise hand button in the bottom of your bottom center of your screen, or if you're on the phone, you can simply dial *9. Once you raise your hand, you'll be added to a queue with others who have raised their hands. I will call on folks on a first come, first served basis. When it is your turn to speak, I will say your last name or the last 4 digits of your phone number and let you know that I am unmuting you. If you are on a computer or a mobile device, a box will pop up at the center of your screen. You will need to confirm that you'd like to be unmuted before you begin speaking. If you're on the phone, an automated recording will let you know that you are unmuted. You may speak as soon as the recording finishes. Once you are unmuted, everyone in the meeting can hear you. Before making your comment, please slowly state your name and any organizational affiliation. And please remember to speak slowly as we have interpreters working with us this evening. We ask that you please limit all comments to no more than 2 minutes. We ask that you make only 1 comment so that we can ensure everyone gets an opportunity to speak. As soon as you're finished, you will be muted again. There are some clarifying questions that I see here on the screen. First, I'd like to ask if there are any elected officials that would like to speak. Simply ask them to raise your hands, and we're happy to take take you and ask you to speak. So before I get into the some of the clarifying questions, I'll go back and forth. I'm going to ask State Representative-elect Jessica Giannino to say a few words. Representative-elect, I'm unmuting you now.
Hi, and thank you, Angel. Can you hear me?
Yes.
Wonderful. So first of all, thank you guys for taking the time to put this together. My name is Jessica Giannino. I'm a city councilor in Revere and the state rep-elect for the 16th Suffolk District, which is Revere, Chelsea, and Saugus. So I'll be brief. I know some of my colleagues in the council have already submitted letters with our concerns, but basically, you know, Revere is affected by bus routes that include the 116, the 117, the 110, the 430, and so on. Some of the biggest concerns for us are the elimination of bus route 428, as well as the shortening of the Green Line. So those are 2 major concerns that impact my district. And, you know, of course, the factor of jobs. You know, there are so many people employed by the MBTA and members of local 589 that are going to be really impacted by these cuts. So those are some of my concerns, and I will submit a letter, but thank you for your time and thank you for the presentation this evening.
Thank you very much. I have a clarifying question here. How will you know that ridership has returned if you have cut that service?
That's a good question. We will we'll obviously be looking at ridership levels, not knowing the specific service they're referring to. We'll be looking at ridership levels on complementary services. We'll also be looking at traffic congestion on kind of the alternative routes. I don't know, Laurel, if you have additional insight, I would welcome it as well.
Sure. We'll also be taking into account, we have an employer survey that we use to gauge employer plans, as well as a customer survey that we use to gauge ridership plans that we've been asking people about their travel needs. And then also, in addition, we'll be looking at the phases of the economic recovery and what, you know, what events are returning to Boston and other travel demand drivers.
Thank you, Laurel. The next question is, what is the threshold separating highly transit critical population and a less transit critical population?
Sure, I can attempt to answer this one as well. This is an index of a couple of different factors. So it includes where we see people traveling who are coming from communities that are low income, communities of color, and also places where there are 0 to low vehicle households. And so because it's an index, it doesn't have a really clear threshold that is a break point of like percentages with each of those factors. But we looked at all three of those things combined to see where there were the most riders who were most dependent on the MBTA.
Thank you. And then one more, and we'll start flipping back and forth on questions. The question was, how were the numbers derived for the commuter rail?
Sure, I can also answer that. We get counts from conductors on the commuter rail. So ridership counts from the conductors for ridership on board. So if that's what the question is about for ridership, we also, some of the data we also look at our demographic data for our commuter rail riders, which comes from surveys that we do on board the trains.
Thank you, Laurel. Next, I am going to mute Mr. Jason McCann. Mr. McCann, I'm going to ask to unmute you now.
Hi, everyone. My name is Jason McCann. Thanks so much for the presentation and also putting so much effort into getting public comment and hearing from everybody about the proposed cuts. I'm with the grassroots group Save the Ferry, savetheferry.org. We've been working to really tell the stories of all the different people who ride the Hull Hingham Ferry in particular, and call for a change in the decision to completely cut the service. We're hoping for a change in that decision because we've heard from lots of people who really don't have an alternative and find the service quite essential. If you go to our website, you can see a lot of different testimonials from different people, including we've heard from one woman who has a daughter with a disability, and the ferry is the only way that she can take public transportation because it goes point to point from Hingham into Boston. We've heard from multiple people who use the ferry for medical appointments, people of all ages. Again, the only way they can get in from the South Shore to Boston, they can't really drive themselves. Not to mention many frontline workers, nurses especially, who have been taking the ferry all throughout the summer. It's a reliable form of transportation. It's been their only form of transportation to get into the city from the South Shore and do their work. So I would say, I know a lot has changed since these cuts were first proposed, and the Hull Hingham Ferry itself, I know from your own statistics, is at something like 23% of the ridership it was last year. To me, that sounds like something in line with your statistics on the Green Line and the Red Line, and those lines obviously aren't being cut completely. So, given that we're in a COVID surge and the ferry is probably the only form of public transportation where you can stay outside and do some safe distancing from each other, and also that at the same time we're getting close to a vaccine, and we anticipate more people will be going into the city from the South Shore, I would just ask that you reconsider the complete cut of the Hull Hingham Ferry, given all this situation. And thank you for the time.
Thank you. Next, I'm going to unmute Miss Martha Reardon-Bewick. Ms. Bewick.
Thank you. Can you hear me?
Yes.
Yes. Thank you so much. I'm Martha Reardon-Bewick, a Hingham Ferry advocate since 1974. The Massachusetts Bay Transportation Authority offers superb and cost-effective public transit service through its Bay component, the Boston Harbor Ferries. Pre-COVID, 50% of Hingham's 2,000 commuters to Boston were transit riders. We're proud of our transit ridership. The key Hingham Ferry route to Rose Wharf carries the greatest ridership, totally reliant on on-time arrival, where 93% are commuters. You must keep the ferries operating to Rose Wharf as a dependable transit service link, particularly while there are so many construction projects underway, both along the commuter rail and the Red Line to South Station, as well as to Charlestown, while the North Washington Street Bridge reconstruction endures through 2023. Ferry services must be maintained as a complete accessible network, as a modified essential service in the short term without any route cuts. I urge the MBTA to continue to sustain this incredibly important economic network while we wait for the arrival of vaccines, the arrival of new federal support outlined by Congressman Lynch, and the reopening of our region. Having been involved in the ferry since 1974, it has been absolutely stunning to me to realize the incredible ripple effect of the MBTA's public investment in ferry facilities on economic development around Boston Harbor, particularly at the Hingham Shipyard, at Rose Wharf, and at the Charlestown Navy Yard. For a relatively small public investment, the MBTA has created a powerful maritime transit engine, driving and sustaining almost $2 billion in private investment at these locations and thousands of construction jobs. The MBTA also provides an outstanding contribution to the environment in offering attractive, on-time public transit using the fixed guideways provided by the uncongested navigable waterways of Boston Harbor. Please don't give up the ship. Thanks so much.
Thank you. Next, I'm going to ask to unmute Brooke Weirs. I'm asking to unmute you now. Hello.
Hi, did that work?
There you go.
Excellent. Whew, wow, this is a lot. You guys are going through a lot, and I appreciate everybody taking the time. I wanted to say I myself am a retired physician. I grew up in Hull. I went car-free myself in 2010 just because I thought it was the right thing to do for the environment. And I spent a lot of time taking the 714 bus that connects to the 220, and then taking that into the Red Line in Quincy. And the people I see on the 714 are not the kind of people that look at MBTA meetings on the internet. So you're not going to hear from these people. They are people like the people that live in my mom's house. Even though there is one person in that house that has a car, that house actually contains 5 households. There's one African-American guy that uses a 714 to get to his job. There's a blind guy who refuses to take the ride and uses a 714 to visit his son. There's 2 elderly households that use the 714 to get groceries. And then there's one white guy that lives in the basement and he has a car. So it might look like the house has a car. The ridership, the people, believe it or not, I sit on that bus on the 714, 1 out of 4 people pays. So like they're broke. Like they won't even take the Greenbush line because it costs $8.75. They'd rather wait for an hour for the 220 in the cold because they don't have that amount of money. And so you might be under measuring both how much the ridership is, because people aren't paying if that's how you're measuring, and also criticality. There's no other place. I looked at that map. There's no other place where when the MBTA is eliminated, that then people remain 7 miles away from any other form of transportation. But if you look at the map, when you remove the 714 from Hull, people are going to just be stuck. And I would encourage you to maybe take that criticality and put it in a different category. Thank you.
Thank you. Next, I'm going to unmute Daniel Gromat. Daniel, I've asked to unmute you.
Yeah, can you hear me?
Yes, we can.
Yep.
Yes, good evening. I live in Newton, near Newton Center. And I'm really discouraged about the number 52 bus that goes from Watertown Yard down to Dedham. Apparently, where I live with others that do not drive. And apparently, the 52 bus is the only way, a most convenient way to get to Dedham. And if you're planning to eliminate that bus route, it's going to make that getting to Dedham much longer, much harder. So all I'm saying is that even though the 52 bus is a low ridership route, sometimes it's a chance that it could still be a necessity for those who do need to travel in that direction. The green line does not go in the right direction, And apparently, with the 52 bus being eliminated, it's gonna make it hard for some of my housemates to get to Dedham. There's actually a mini bus hub with other routes like 34 and 35 that terminate at the Dedham Mall. So all I'm saying is that 52 bus being eliminated is going to make a lot of hardship to a lot of people who live along the route. Yes, thank you very much.
Thank you. I'm going to ask a clarifying question that I see here on the chat. I would like some clarification on what the Fairmount weekend service will look like and when this would potentially take effect.
The the potential changes in commuter rail would take effect primarily over the spring. I guess I'd defer to Rob Diadamo on the specific timing and also what the bus service would look like. The bus service would be, it's something we've run on a number of occasions when we've had to do repair work on the line. It's roughly consistent with the frequencies, but I'll let Rob answer that.
So the commuter rail, the weekend changes are expected to take place this summer. The changes to the daily schedule, the late night shutdowns, and the changes to peak service are scheduled to take place roughly the third week of May.
Thank you, Rob. Let's see, the next person that I see here is Holly Berry. I'm going to ask to unmute you.
Thank you. Can you hear me clearly?
We can.
Okay. First of all, I'd like to thank all you gentlemen and ladies for hosting this meeting. It's more of a comment or an insight. I mean, they say this vaccine is coming out and they assume that they're going to hit the entire population within 6 months with this vaccine. So it's kind of like a twofold question. So if that is true, then your strategic plan going forward that it's going to begin and start taking place, and a lot of the implementations will be happening in the spring and the summer. I kind of, that concerns me that although you've put such great effort and time into the formulas of how you've reached these points, I know that these plans have been in place for a while and the vaccine is coming. And then the other thing is, I have a severe neurological disability and I use the ride and to get to all my doctor's appointments, and they're somewhat frequent with such a rare disease. That being said, to implement any premium costs to my ridership while I receive disability and I'm this poor is concerning to me, while the upgrades by the MBTA and expansion has been going on through the time of the COVID. To put that additional premium cost on my back is somewhat unfair. And to the other gentleman's point, I'll wrap up with saying the formula in which you determine the numbers for ridership, I would have to agree, it was in a very goodwill attempt, but there are so many people getting on the ride for free right now because they just say to the driver, I have no money. Between unemployment and homelessness, that those people are not actually counted in your formula. So I think those are some observations I've made. And I think that one last thing. When it comes to, you said there'll be adjustments if you see an increased ridership. That being said, not everybody has access, or we can't assume everybody has access to the internet and electronic devices such as I'm privileged to have. That being said, if you put up posters or something where people ride the bus, where they could submit, whether it's a written letter or a phone call or something, if they have concerns and service cuts, I think that would be the fair thing to do, because a lot of people don't have this luxury that we all have this evening. And I thank you very much for taking my comments and concerns.
Thank you very much. Next, I'm going to ask to unmute Kylie Clapper. Kylie, I'm asking to unmute you now.
Hi, thank you so much. Kylie Clapper from Hull, Massachusetts. General Manager, Puff Talk, and to all the staff, thank you so much for hosting these meetings. I feel like I'm getting to know some of you after all this time. I just wanted to clarify, and as it related to the earlier comments from both Jason McCann and the position that followed him, we're talking about not reducing ferry service to Hull. We're talking about eliminating it. And along with the 714, it's an absolute lifeline to those households. And I think, I'd be curious, perhaps we could have a clarifying question afterwards, as to like, what defines low income? Because I would really argue that Hull may qualify. I mean, so many people, as have been stated, aren't able to pay for the 714. They are from one car households. And I just wanted to share that. And also, in the essence of time, I wanted to also say, with the Save the Ferry sort of grassroots movement that Jason and a few others and myself have volunteered with, I'm hearing testimonials from a lot of my friends, my neighbors, and residents of the South Shore. And just to say quickly, there's a nurse in Situate who rides the Greenbush and relies on the ferry to get to MGH. There's a woman, in Hull who is going to MGH to get her chemo treatment. These are households in a community that is really transit critical, I would argue. And I think too, so much of the work that you all are doing, and I appreciate that it is hard work and you have to look at the data, and I appreciate that. And there are humans behind this, right? And I just think if you eliminate the ferry service and there's no way to evaluate the ridership during an elimination, we may never see it return. And with the investment that we've made, at least in the infrastructure in Hingham, I would just recommend that to reconsider the elimination, but rather perhaps a reduction in service. Apologies for going over time. Thank you so much.
No worries. Thank you. Next, I am going to call on Franklin Salambini. I apologize if I mispronounce your last name.
Thank you very much, Angel. I'm calling from the Arborway Committee for Public Transit in Jamaica Plain. I did listen to Mr. Povtek's presentation regarding the suspension of the E line at Brigham Circle, and in his comments, he indicated that those riders who would be heading further out to Heath Street and the VA hospital would be diverted to the 39 bus. Those riders that we're speaking of are Section 8 residents at Back of the Hill Apartments. They are the disabled residents at Back of the Hill Apartments. They are veterans who are seeking medical assistance at the VA hospital. These certainly are members of the community who are most at risk and most in need of the service. Mr. Povtek also indicated that they would be diverted to the 39 bus. Over a period of 20 years, I think the ridership on the 39 bus speaks for the type of service that the 39 provides. In 1992, there were 19,000 riders a day on that bus. By 2005, ridership had fallen to 14,000. Just last year, it was recorded at 11,000. It's really not an equivalent service. The other issue that arises is the configuration at Brigham Circle itself. Getting off the streetcar at Brigham Circle, the bus stop is across Francis Street on the other side of the intersection. And so individuals who are disabled or who are seeking medical assistance for any reason at the VA are put in a very difficult position getting across that intersection. My time has elapsed. I think the final point is the service to Heath Street should not be suspended, but should continue. Thank you very much for this evening. It was very helpful.
Thank you. I have a clarifying question here. If ferry work cut, when would that cut occur? Seems at odds to continue ferries or to discontinue ferry service when ridership is likely to increase.
That is one that we are evaluating. It potentially would be cut anywhere from January to March. I think we have March up on the slide deck, but we would that is something we would evaluate.
Thank you. Next, I'm going to call on Michelle O'Leary. She is next on my on the sheet I'm seeing here. Michelle.
Hi, Steve, Brian, Shannon, and Angel. Thank you very much for this opportunity. I've spoken at a couple of previous meetings as well. Again, I'm a registered nurse at Mass General, and I live in Hull, and I take the commuter ferry 5 days a week, and I have been for several years. I take the 6 o'clock ferry. This morning we had 32 passengers. I know that doesn't seem like much to you. And the news is reporting an average of 7 passengers per ride, and I'm assuming that's an average over the whole day. But, that's 32 people, and most of them are frontline workers, healthcare workers. The ferry is an essential mode of transportation to us for many reasons. One is its dependability and reliability. I have colleagues who take the Greenbush and the Red Line, and at least once or twice a week are late to arriving to work. As a registered nurse, when you get to work, you're relieving the night shift. So it's very important to get to work on time. My question is, what if you are going to eliminate the ferry, which I hope you won't, what will you do to guarantee or improve on the current other MBTA modes of transportation, the Red Line, the bus, the Greenbush, to make sure that we can, as frontline workers, continue to go to work every day and get to work on time? I have proposed at other meetings that potentially there be a reduction in service and maybe just do commuter times, 3 ferries in the morning, 3 ferries in the late afternoon, whatever you deem as the most commonly traveled ferries. I really would appreciate it if you would reconsider the total elimination of the ferry for us frontline workers who have continued to work through the pandemic and will continue to work to make us all safe. Thank you very much for your time.
Thank you. Next, I'm going to ask to unmute Ari Osovit. Ari.
I think Ari needs to unmute on his end.
Sorry. Thank you. Sorry. Well, some of this changes, the schedules that you're talking about may be reasonable. The MBTA here is using a hatchet approach when a scalpel would be better advised. The proposed cuts are wildly inefficient. For instance, 30% of rapid transit service is cut to save 5% of costs. That's 1 in 6. 35% of commuter rail to save 10% of costs, and 15% of bus service to save 7% of costs. It seems like a lot of cutting of service to save a small proportion of money. It doesn't take into account lost fare revenue, which the T pegs at 21% of these savings. And while reductions of frequency may not cause big problems, cutting service fully will. So we've had a lot of people talk about the ferry. I'd like to bring up weekend commuter rail service. According to the presentation, there are about 14,000 weekend trips on the T today per weekend. If we assume $7 in fares per trip, that would account for a $5 million loss of revenue. It's a third of the realized savings. Even if ridership doesn't increase in the next year with news of vaccines, which it probably will. Cutting service after 9 p.m. would also be another $1.5 million. And as we approach herd immunity, these numbers would only go up. Weekend commuter rail service is also, according to the data that you've posted, carrying more people per train than weekday commuter rail service. Weekend service has retained 45% of ridership as opposed to less than 10% for morning peak. It hardly seems reasonable to move to cut back service, which is carrying more customers. Since most of the cost of providing this service that we've been talking about is fixed, Most of the savings and changes come from labor. Labor, as you may or may not know, is comprised of residents of the Commonwealth, mostly middle-class jobs, and these people are paying income taxes. So if you cut their wages, you cut our taxes. Finally, look at your bus schedules. I watched the 47 bus that left at 5:55 from Central Square at the start of this meeting. It's scheduled to take about an hour to make its trip. By the time it got to Ruggles, it was 16 minutes ahead of schedule. We've been in the pandemic for 9 months and no one has looked at these buses. So before you go cutting service, why don't you go to the scheduling department and see what kind of savings you might have there. Thank you.
Thank you. Next, I'm going to unmute Jennifer Smith Workman. Asking to unmute you.
Hi, can
Hi.
you hear me?
Yes, we can.
Okay, Jennifer Smith Workman. I am on a ride subcommittee, the RTAG ride subcommittee, and I'm also a rider, disabled rider. And my question is, oh, hi, Rob. My question is in regards to the premium fares. Like one woman had said, she is and concerned about the premium fares. Now, I take the ride to Brockton, which is a premium fare. Will that premium fare be increased to a significant premium fare if they were to, say, get rid of the 230 bus route or the BAT bus? You know, the Dalabat, the BAT bus that goes to Brockton. Say if that were to happen, would that increase in that fixed route? That price, that premium fare? Because we're already on fixed incomes. Thank you.
Thank you. Next, I'm going to ask to unmute David Fargan. Sorry.
Okay, hi, can you hear me?
Yes, we can.
Yes.
Okay, good. I'm a resident, David Fargan. I'm a resident of Mission Hill in Jamaica and on the Jamaica Plain line. First of all, just watching the tone of this, I'm trying to understand why we are not assuming that because of the nature of coronavirus pandemic, that ridership, it's a given that it's going to be back at 100%. And it's the choices in modal choices, whatever, are not a function of rider choice. It's a function of people being told, don't go to work. This is going, and when I saw Representative Lynch the other day, and he was saying, why are you rushing into this right now? We don't even have coronavirus CARES Act extensions or anything like that done yet. And yet we're looking at, we all know that sure, in the interim, we can, as a spigot, turn services back. At the onset of this, Director Pofek said that this is not a long-term strategy. And yet, you know, if you live here near Heath Street Station, and I'm talking against the proposal to eliminate service from Brigham Circle to Heath Street, but if you talk about the truncation of service there, that is exactly what this is, eliminating a service. Why can't you, like the rest of the transit, what's magical about this segment of roadway? I don't understand, and why it's always in the target of the T. Take a look at our neighborhood, VA Hospital, Sherrill House, AstraZeneca, convalescent homes, hundreds of new transit-oriented development residences just within the last several years. This is a community that truly needs this service, and it's like a torpedo to the heart of the community to fully eliminate these stops. Please do not do that. Thank you.
Thank you. Next, I'm going to unmute Tom Gilbert.
Hi, it's Tom Gilbert from Somerville, RTAG e-board member and MBTA main plaintiff. Just wanted to comment again on the on the E-line of not eliminating that. the Veterans Hospital is obviously in ADA stop, and I just don't understand why you want to eliminate that. On the other hand, I don't understand why it simply just can't go express from Brigham Circle to the VA hospital, and then simply have the 39 pick up of where the trolley would stop in the middle of the street. It's actually safer to get on the 39 bus than it is to wait in the street and get hit by a car, or maybe the car might not stop for you if you exit the trolley or the streetcar in the street. I think a more practical way of solving this is just to have it run express from Brigham Circle to the VA hospital, and then have the 39 pick up of where the streetcar would leave off. On the second comment I wanted to make was the elimination of the 52 route. Did the MBTA do any consulting with the Carroll Center for the Blind? The Carroll Center for the Blind. Think about that, guys. If someone's going for the Carroll Center for the Blind, they actually need training on mass transit. And where's that going to be? How are they going to do that if they don't have a route for visually impaired individuals to be able to make their trip to the Watertown Yard or to the Dedham Mall? They would need like a taxi or other types of means of transportation in order to get to a bus stop in Watertown or a bus stop in Dedham or wherever they might do the trip. And that's what I wanted to say about that. Thanks.
Thank you. Next, I'm going to unmute Sabrina Davis. Ask to unmute. I just asked to unmute you.
Hello, my name is Sabrina Davis. I'm an advocate with the Coalition for Social Justice and also a member of the Green Justice Coalition. As we've heard with all these testimonies, this is gonna come at a cost of, well, a lot of people, these cuts. Public transit is a public good, and it's a public good for a reason, because although you may see low ridership right now, the people who are riding desperately need that transportation, and you're cutting that. Is there any way for you to maybe scale back? Because with that, I know here in Fall River where I live, there's no service on Sunday, and I've come up against that. So I have a pretty good idea what that's going to be like. It's just horrible. Also thinking back to our climate promises and things like that, we're not going to meet the goals that we need to meet to help mitigate climate change. And it's also going to increase traffic, because people who would take public transit and have cars are going to be using their cars, which will have other effects. I just want you to take that into consideration before you completely cut service.
Thank you for your comments. Next, I'm going to ask to unmute Jack Peterson.
Hello, my name is Jack Peterson. I'm from the Boston Area Service Industry Coalition. BASIC, we represent food service workers throughout the Boston area. I'm representing tonight because most of us are working right now. Firstly, I have a couple of comments. Firstly, I really want to say thank you so much for keeping Blue Line service intact. As you all noticed on your own charts, that line is where the majority of our most vulnerable workers use at this moment. So I really, really appreciate that. Secondly, I want to say thank you for the iterative design process direction that you're taking on this. Our hours as restaurant workers have fluctuated wildly, especially with changing curfews, and we expect us to keep changing. So we have asked our constituents to submit specific feedback if there is a line change that will affect them. And then really on top of that is our primary concern is to cut to the late night hours. 80% or 60% of our members said that cuts to late night hours could affect their ability to get back home. And what I really want to make clear to the MBTA is that I understand that this is a difficult time for everyone. And we as food service workers are just anxious about how these cuts could affect us. We're already precarious on rent. We've already seen lower tips. We've already seen severe cuts to hours. So we just want to ensure that we're safe. If there's any way that we could collaborate with all y'all, if there's any data that we as Basic can provide you, if there is maybe a lighter weight solution that could help late night workers, we would really love to work with you on that. Thank you so much.
Thank you very much. Next, I'm going to unmute Ian Hype.
Ian Hip is my name. Clean Water Action organizer. Clean Water Action, we represent over 30,000 members throughout the state. We're opposed to these cuts. We center our climate advocacy in economic, racial, and environmental justice mandates. And from strictly an environmental perspective, this is a terrible idea. Cuts, please consider that these cuts will harm our environment, our air quality, our climate. And based on the MBTA's own estimates, more than 19,000 people will lose access to transit at the time and place that they need it. These people, along with all the people who are waiting longer wait times, they are likely to turn to cars. And this is going to increase traffic. It's going to contribute, this pollution is going to contribute to climate change, and it's going to help create the bad air quality that is known to worsen these COVID outcomes, especially in environmental justice communities that are hardest hit by this disease. So that's all I got. Thanks.
Thank you. Next on my list, I see Andrew Jennings. I'm going to ask to unmute you now.
Thank you. I am retired and live in Billerica. Prior to March 10, I averaged about 3 round trips per month from North Billerica to Boston for various reasons. Many of these trips were over weekends and some involved returning from Boston after 9. After I am vaccinated, I will quickly resume such trips, although there will be fewer of them because of the unexpected success of virtual meetings. I have 3 comments. 1, I'm very curious what is occurring at Mass Highway as a result of the funding shortfalls. Toll revenues are down, gas taxes are down, and there's a financial crisis at Mass Highway as well as the MBTA. If Mass Highway is operating as normal while the MBTA is making significant service cuts, there's something very wrong. Second, if your strategy is to wait for ridership to increase before restoring the cuts, the strategy is flawed. Transit must be ahead of the curve. You will not see me as a rider if you wait for me to show up before you restore the cuts. Third, much of MBTA's patronage came because the alternative was worse. Auto travel during the pandemic has gotten much better as gas prices have fallen and congestion has lessened. If MBTA expects to return to pre-pandemic ridership, it must move not to restoring service, but towards restructuring its service so that the transit is more often the mode of choice. Please don't leave me without commuter rail service on weekends and evenings. There's no effective public transportation alternative available to me. I will ride a bus if you want to cut costs, but please don't take the service away. Thank you.
Thank you, Mr. Jennings. Next, I'm going to ask to unmute Mr. Jonathan Alves.
Yes, thank you. This is Jonathan Alves. I am a lifelong resident of Massachusetts. I am a 7-year resident of the South End, a frequent commuter rail and public transit rider. I appreciate everybody's thoughtfulness in pulling together data and presentations associated to the service cuts in light of the pandemic. However, I must state that I am very disappointed. I'm disappointed several years ago when 13,000 riders were disenfranchised when late night service was cut, when this board voted to do that. I was disappointed when a year or 2 ago, the board voted for a 6% fare increase across the board to cover costs, which greatly affected many riders and their ability to pay for rides. And I'm disappointed today that the same board is proposing service cuts at a time when many of us and our most vulnerable need access to this service, especially in light of positive vaccine news that's going to be happening at the time when these service cuts are deemed to take effect. So my question is, and I went on record a couple of years ago saying the same thing when I was trying to advocate for many of those who can't be here today to advocate for themselves, is why does the MBTA, why does this fiscal management board continuously look at funding the MBTA through the lens of ridership alone? The MBTA service is a public good, is not designed to be a money-making operation. This board needs to start thinking outside of the box to find ways to fund it and keep it going. The levels will return, and if you wait for the riders to do so, you're going to be in a much more difficult position than the system already was. Thank you for your time, and I appreciate you allowing me to share my feedback.
Thank you very much. Next, I'm going to ask to unmute Rosemary Jones. Ms. Jones, I've asked to unmute you.
Now, yes?
Yep, we can hear you.
Okay, great. I want to thank you for doing this. And also the other folks who have made comments, I'm enjoying a lot of your comments and learning from you. So this is wonderful. I'm a resident of Jamaica Plain, and having come from Missouri, the contrast between public transportation that was available in my home state and what is here in Boston, just no comparison. So I'm very fond of the MBTA. I use the commuter rail to see a friend in Rhode Island who lives close to the TF Green station. And I have not needed to own a car. Bless you, this is great. I'm here as chair of the Jamaica Pond Association in Jamaica Plain, echoing what Franklin Salambine said. The association strongly opposes cutting the line to the Heath Street VA stop. Our veterans and the workers deserve better. And I'm talking about the workers along South Huntington Avenue at the caregiving sites that have been mentioned, as well as at the VA, as well as folks who live at the back of the hill. I know I'm kind of talking kind of fast. And I'm wondering, do you measure discouragement and clumping? Do you just measure how many people get on, like for instance, the 39 bus? Or do you measure the people who stand and sigh in the wind, say at Brigham Circle, or at the stop at South Huntington and Route 9? There are new medical institutions, new offices there, and there are people, and I've run out of time, but not out of words, but I will stop.
Thank you. I'd just like to remind you, Ms. Cohn, that you can reach us at mbta.com/forging ahead, and you can continue making your comments there as we do have comments available up until December 4th at 5 p.m. So encourage you to visit our website. Next, I'm going to ask to unmute Rachel Hitt.
Hear me now?
Yes.
Yes.
I'm a frontline worker and I also work at a hospital, but one of my main concerns, there's only 9 trains in and outbound on the Worcester line on Saturday and Sunday. Instead of eliminating that, would you consider, even if you reduced it to like 5 or 6 trains on Saturday and Sunday, I figured that could be a happy medium. It's still a reduction, but we frontline workers can still get to and from work. I was wondering if that would be a happy medium compromise for weekend service. I mean, I'm definitely against the cuts after 9 p.m. because but I was wondering if that could be a happy medium for the weekend, because I know you guys really were wanting to eliminate service on the weekend across the board. So I had taken a look at the schedule through my phone, and I was wondering, and I counted, there's 9 trains on Saturday and Sunday. If we had reduced it to 5 or 6, would that be a happy medium? Could we compromise on that? Because we have a lot of top hospitals on that one commuter rail route. Thank you.
Thank you very much for your comments. We are taking everything that we're hearing today into consideration, as again, and these are proposals that the board will consider. Next, I am going to ask to unmute Mr. Tom Gilbert. Mr. Gilbert?
Right here, Tom Gilbert again from Somerville. I just wanted to finish my thought going back to the to the E-line to the VA Medical Center. Now I understand that in the future that they're supposed to make these stops between Brigham Circle and Heath Street accessible. Now I'm assuming that that's going to be center stops like on the B line and the C line. So I'm thinking that you're actually dealing with a very similar situation like you're dealing with on the B line. They're going to consolidate BU West and Babcock Street and subtract two St. Paul and Pleasant Street on the B line. So why not make like when the stops become accessible on the E line, make like either like instead of having 4 or 5, make 2 or 3 good accessible stops that would stop between Brigham Circle and the VA hospital. You know, and I think that would, if you think about what's going on the B line, and you think about what's going on the E line, it's kind of a similar situation. On the B line, you have the 57. On the E line, you have the 39. So it's balancing the bus travel and then having the VA Medical Center for the vets that need that would need to stay on the train because of severe weather, like when it's really too cold or too hot out. So some in-wheel mobility devices have trouble regulating themselves, so they can just stay on the train and just for now go express from Brigham Circle to the VA hospital. It'd really be, I think, beneficial to them. And in the wintertime, Boston doesn't always shovel their walks very well, and then and for vets that could also be an obstacle around snowbanks, ice, you know, all such things like that. They can again just stay on the train, go express to the VA hospital. They're there. Thanks.
Thank you. Next, I'm going to call on Mr. Matthew Wong.
Hello?
Yep, we can hear you.
Good, thank you. My name is Matthew Wong. I am a student at LaSalle University in Newton, Massachusetts, with my permanent home during the academic off-season in Salem, New Hampshire. I, for one, am concerned primarily with the elimination of weekend commuter rail service, because due to the pandemic, it's very difficult to get a parent on campus. And so there's a whole process that has to be gone through in order to allow a parent, because they're considered to be an outside guest. And therefore,
Mr. Wong?
Away from campus. And losing weekend commuter rail service entirely could potentially prevent me from getting home on a weekend. The other comments that I would like to make is that I observe quite a bit that there's quite a few instances of redundant service currently. And I would wonder if perhaps either cutting or eliminating the redundant service instead of eliminating an entire service that has no redundancy would be a better alternative. For example, the E-line is completely redundant to the 39 bus in its entirety. The 39 bus even goes all the way to Arbor Way, which the E-line no longer does. So I would wonder if using just the 39 bus with extra capacity except during rush hour, would be a better way to save resources, and then add in the trolleys during rush hour, and the bus could make the exact same stops that the trolley makes, but it is only using one resource for the same corridor. Likewise, many of the stops along the B and C branches are within walking distance of each other. The train literally stops at every single street block for the most part. So could we consider like eliminating every other stop, or running express trains that skip every other stop, where one could easily walk between two stops, and therefore that would save resources and make the journeys faster. The other thing is that, I noticed especially on the Haverhill line of the commuter rail, Bradford and Haverhill, there doesn't need to be two stations for Bradford and Haverhill. Bradford was literally a short walk across the river from Haverhill, and so that it's literally half a mile across the bridge. So there doesn't need to be a stop in Bradford, I don't think. Keep Haverhill because that has the Downeaster connection, and just bring all the trains straight into Haverhill, cut Bradford for now. Likewise, the southern portion of the Haverhill line is redundant to the Orange line. So I'd question, do we need both the Haverhill line service and the Orange line service between Malden Center and North Station? That seems a bit redundant in and of itself too. Finally, I'd like to echo what some other people have said about the timing of this, with the vaccine hopefully around the corner. If these are rolled out right when the vaccine comes out, that doesn't seem to be really accomplishing anything. In fact, it will be setting us back in terms of economic recovery. I also would like to echo about what they said about the E branch running express between Brigham Circle and Heath Street. Those stops in between are outright dangerous. You literally have to wait on the sidewalk and literally walk across an active lane of traffic on South Huntington Avenue to board the train in the middle of the road. That is dangerous. So I would endorse closing those stops in between, but still keeping the terminus at Heath Street for the purpose of the VA hospital. Thank you.
Thank you for your comments. Next, I'm going to call Mr. Evan Foss. And hold on one second. I seem to be having a bit of a technical issue on asking to unmute you. I'm gonna skip and go over to Mr. Daniel Scapagnoli.
Hi, everybody. My name is Daniel Scavangelli. I'm calling on behalf of UMass Boston. Thank you all for opening up your Forging Ahead program to the public and for taking our questions. So I just wanted to mention that nearly 60% of our students take public transit, and we're estimating that currently 1,200 members of our community are relying on public transit in order to get to campus. That's for this and next semester. And so I just want to bring to your attention the number 8 and 16 bus routes. These are critical routes that help bring our community members from JFK UMass Station to our campus, which is a little over a mile. With the current transit cuts to these bus lines now, our community members are waiting close to 40 minutes between 11 a.m. and 3 p.m. to get to campus, which is peak time for their classes, labs, and simulations that are currently being conducted in person on campus. So this wait time disincentivizes commuters from taking the TN bus and incentivizes them to drive alone to campus, which not only has detrimental impacts to the environment and to the MBTA, but also fails to show an accurate demand for the service. So I just propose that as you build back service, you work closely with university representatives across Greater Boston in order to more accurately predict demand for transit services as universities plan to reopen. So thank you for your time.
Thank you. Still working through that technical issue, and then I will call on Mr. Foss. I apologize for that. Next, I'm going to ask William Amara to unmute.
Hello there. Can you hear me?
Yes.
Hello. Thank you for having this forum. I want to speak specifically on the difference between reducing service and cutting service completely. We've had many great advocates for the ferry service, but I want to specifically speak on the idea of completely cutting weekend commuter rail service. There are lots of deleterious effects from this, especially taking into account the recovery of public transit to 2021 with possible vaccinations coming out. Specifically, the fact that there are so many regions of Massachusetts that will be hurt by this. There seems to be this assumption that it's not transit critical outside of just the city of Boston, but remind you, Providence, Worcester, Lowell, Lawrence, Haverhill, Brockton, Salem, Lynn, these are all places that will suffer immensely if you cut a weekend commuter rail service. And this will have knock-on effects. So if during Boston's recovery from the virus, if people can't take the commuter rail in, it will lead to more people driving into downtown Boston, which will make traffic worse, which has environmental harm. Also, it will lead to crowding on the subway lines, which, if there's still somewhat of a pandemic into next year, that could be dangerous. So I want you to strongly consider the negative effects of cutting weekend commuter rail service, and echoing previous points made, consider reducing service rather than cutting it entirely. Thank you.
Thank you. Next, I'm going to ask to unmute Mr. Evan Foss one more time. Mr. Foss, I think you've been asked to unmute. Mr. Foss?
Yep, there we go. The cuts that are going to take place are based on this notion that you know, this is just going to carry on through all of 2021, which we know to not be true, as other people have pointed out. And I find it hard to trust the T, as I think a lot of people would have in the history that the T has. The E line has been cut previously, initially with the explanation that it would only be temporary, and it wasn't. Its original terminus used to meet up with the Orange line. The A line was also not officially cut for ages. I have an uncle that worked for the T for 20 years, and well into the period when the T stopped A line service, they were still riding it to get the employees in on some days, all the way through the 90s when the MassDOT finally started paving over it, and that was when you officially ended service on it, even though it had been off since the 60s. The Orange line was left to rot until eventually it was more economical to relocate than to keep where it was. And even though the promise in various pieces of paperwork filed to the federal government was that you would provide equal to or greater than service, you never actually did. The Silver Line is a piece of junk. It gets crowded, the buses get clumped together, and the headways that were promised have never fully delivered. I used to go to, I got my degree from Northeastern, and I used to take the E line. Well, I could outwalk that bus, and I'm not going to run long on this comment because I have previously, but you get where this is going. Thank you.
Thank you, Mr. Foss. Next, I'm going to ask to unmute Mr. Thomas Dodge. Mr. Dodge.
Hello, thank you for your time. My only main point is a question to prepare ahead. I would assume that if the Georgia elections, shift the Senate, there would be a massive infrastructure plan on the table. And I'm just wondering if the MBTA, well, I know the COVID crisis is a priority, is thinking ahead to actually the possibilities for expansion of services if the right package were passed in Congress. So my only point is, while it's important to think now, we shouldn't lose sight of the opportunity of a infrastructure project that's been talking about for a while to actually pass, and for us to, as a city and Commonwealth, to be prepared for it. Thank you for your conducting this forum in the first place.
Thank you very much. Next, I'm going to unmute Stephen Wench. I'm going to ask to unmute you now.
Thank you very much. How is my audio quality?
Yep. Good.
Excellent. Stefan Wunsch, resident of Lynn, Mass, co-chair of the MBTA Rider Oversight Committee. I've participated or at least attended every moment of every one of these series of meetings. And as we're coming up on the tail end of the final evening, I have to express my appreciation for everyone at MassDOT, at the MBTA, and CTPS, who have been involved not only in developing this proposal, but also in executing on this really superb series of events, the execution of which I think is unprecedented, which is necessary in these unprecedented times. So again, my thanks, and I'm sure I speak for all of the members of our committee. A great thank you to everyone who has produced this. It's clear that you are all taking this serious situation very seriously. And although we hope for better in the near future, I'm glad to see that we're all working together with such excellent, again, outreach to the public. It is greatly appreciated, particularly when events like this at the time of the day keeps you away from your families. So again, thank you very much. Keep up the good work, and we're hoping to be of whatever assistance we can at the MBTA Oversight Committee. Thank you.
Thank you. Next, I'm going to ask to unmute Khalik Williams.
All right, can we hear me?
Yes, we can.
Great, so thank you. My name is Khalik Williams with Community Labor United, as well as the Green Justice Coalition and Public Transit Public Good Coalition. So I've been at a number of these meetings, and it seems that the theme is that these cuts are wildly unpopular. Folks get on and they continue to say the same thing in terms of how these cuts are going to affect their daily lives in a negative way. We have riders, workers, community groups, environmental groups, labor unions, business groups, elected officials, and more have all spoken out against these cuts and how unpopular they will be. The people that will be disproportionately affected are those who depend on the system. Those are the folks that can't opt out of riding the T. The folks that have continued to ride the T is, as if your own data has said. Honestly, the cuts that we make today are going to could potentially hamper the recovery of not only the system, but our cities and the Commonwealth, Massachusetts, as we move forward, trying to recover from COVID-19. It is clear that you all have been thinking deeply about this and care about the system, and we'd like to see you continue to work with community, potentially add more meetings, since these sets of meetings clearly are not enough for folks to be able to voice their opinions and to have a meaningful dialogue with you all. And we would like you to vote no on the cuts, but at least expand the conversation. So thank you all, and we appreciate it.
Thank you. Next, I'm going to ask to unmute Conan Home.
Hi, my name is Conan Hom. Years ago, when I was studying public transportation at MIT, I actually interned at the MBTA. I'm an essential worker at the Coast Guard, and my commute is green line to red line to 62/76 to L'Express. So I have a lot of connections, and I get the bind the T is in. But I'd like to say, if you have to make a cut or cuts in service, I think the T can get some more bang for the buck by making the service extremely reliable and on schedule, not late, not early, but on time. So anecdotally, and sorry, I don't have massive amounts of data for all the other routes. I didn't see this happen with the reduction in service in March, even though in theory, the T would have had more idle rolling stock and workers and less wear and tear on the equipment because it was providing less service at that time. And so as an example, my bus still often leaves 6 to 10 minutes late, causing me to miss my last connection. And means that makes my commute from 1 hour and 45 minutes to 2 hours and 45 minutes. And so I guess headway increases with problems in schedule adherence is a pretty bad mix for those of us who have to make these connections. Thanks.
Thank you. And last hand I see here is Scott Sheehan, and I'm going to ask to unmute you.
Hello, can you hear me?
Yes, you can.
Hi, thank you for the moment to speak. My name is Scott Sheehan. I am the commuter manager for Hanscom Air Force Base out in the Bedford, Lexington area. We've had a couple of comments from riders today, a little bit concerned about the changes in the 76 bus route that comes out to Hanscom that supports our 11,000 employees. So we'd ask you to look at that, make sure that those services aren't halted and they'll continue in some fashion. Also, just a recommendation, I'm sure y'all do this, but rather than, we hope your marketing sections are using this opportunity to really do a lot of reach out around the state, because I think coming out of this pandemic, there's an opportunity to actually increase ridership and participation in the commuting services. We were a little concerned last year when DOT closed down the commute.com office and all that, but we really appreciate that. Thank you for taking my comments.
I see that 2 more have been raised. Hands have been raised. I'm going to ask to unmute Roxanne Haker.
Yes, can you hear me?
Yes.
Yes.
Okay, I'm speaking against the truncating the E line, the green line. First of all, to the points that were already made, it is very difficult. Imagining getting off the green line at Brigham Circle and switching over to a bus is absolutely outrageous. It's a disaster in the making. But I'm speaking as an over 30 years living in Mission Hill, and right now living in the Roxbury Tenants of Harvard community, which is over 2,000 people, the majority of whom are low income. About 30% are seniors with all different sorts of issues, health issues there. And 30% are of Latin background and 30% are of Asian background. Like I said, almost all of whom are low income. And the housing is from Francis Street, right there at Brigham Circle, Fenwood Road, all the way down Huntington Avenue to within a block of South Huntington where it turns. We have very high rates of asthma and respiratory illnesses in our children and in our seniors. So it might seem like a really good idea for everyone to have the bus. And I've been on the 39, I've been on the 66, and I'll tell you what happens when there's traffic problems. The buses sit in traffic. The trolley goes forward on the tracks. So I'm speaking from a health basis that we would like to see the trolley stay on to the terminus at E Street. And also to Mr. Foss's point that he made earlier about, I was living here also when we had the promises that the Green Line would be returned. It used to go down Center Street, down to past Curtis Hall, where we all went swimming. We used to had a big economic impact upon the stores in Jamaica Plain as well, because people here used to get on the trolley and get on and off and shop. They don't do that any longer. It's just as easy to get on a bus and go out to Dedham and into the shopping malls. So please think about the health and about the economy of the people who are here, the over 2,000 residents along Huntington Avenue. Thank you.
Thank you. Next, I'm going to call on Mr. Joe Fisher. Mr. Fisher.
Yes, thank you. My name is Joe Fisher. I am a member of the Board of Selectmen in Hingham. I've submitted testimony previously urging the MBTA to maintain the Hingham Ferry Service and the Greenbush line. But this evening, I'd like to speak more globally. We all recognize that public transit use has plummeted nationwide as people work from home or avoid buses and subways for fear of contracting COVID-19, resulting in less revenue from fares. We need to recognize that in cities and towns, public transit is the backbone of the local economy and serves a wide swath of residents across socioeconomic groups. If cities and towns are to recover post-COVID, a thriving public transit system will have to be part of the mix. Public transit needs to facilitate and lead the economy back to health. Many transit systems across the country have been reluctant to cut service. They're concerned that cuts could result in dangerous overcrowding that could exacerbate viral spread. Many cities have been reluctant to cut ferry service because it is the only mode of public transportation that offers the riders the opportunities to sit outside or to have fresh air in the cabin. Public transit ought to be saved. It reduces the number of private vehicles on the road, leading to better air quality and less congestion. It results in fewer fatal car wrecks, and when done well, makes urban mobility more accessible across socioeconomic groups. In the fight against COVID-19 and our efforts to bring back the economy, I urge you to change your perspective and recognize that the MBTA and public transportation systems should be the hero, not the villain in these discussions. Thank you.
Thank you, Selectman. Next, I'm going to ask to unmute Heidi Kopelkamp. I've asked to unmute you, Ms. Kopelkamp. Hello? Hello? I'm going to try one more time. Looks like we're having a bit of a technical difficulty here. If you could just bear with us 1 minute. I've just asked to unmute you. Ms. Kopelkamp, the screen's telling me that you are unmuted. While we do try to get her on, we are getting close to our closing time. I'd like to ask General Manager Poftak to make a few closing statements and then see if we can get Ms. Kopelkamp audio fixed so that she can make her statements. General Manager.
Great, thank you. Thank you to everyone on the MBTA team who put this together. Obviously, most of all, thank you to our riders and our stakeholders who've taken the time out, not just tonight, but also at some of our other meetings to share your thoughts. I want to assure you that we are taking all this information in, we are compiling it and analyzing it. Obviously, these are difficult decisions. We have a lot to consider. As I said, this was a proposal that we put forward through the board to the board. We do anticipate revising it. We do anticipate getting input from the board after we put forward our revised proposal on the 7th with a vote on the 14th. So we greatly appreciate this. It's incredibly useful for us to hear from our customers and we look forward to serving you in the future. So thank you again for your time. Thank you for your participation.
General Manager, we did have one more person that did raise their hand. I'm just going to ask to quickly unmute Ms. Karen Maxwell, and then we'll close it off here. Ms. Maxwell? I've asked to unmute you. Hello? Looks like we are having some technical difficulties there. I would like to remind folks that again, we do have our public comment period is open until Friday at 5 p.m. Where you can reach out to us at mbta.com/forgingahead, and you can reach out to our community liaisons at public engagement at mbta.com. Thank you so much for joining us tonight. We really appreciate everything that you've shared, and please everyone stay safe, and we look forward to continue to work with everyone. Thank you.